And we have one last presentation left. The theme is Korea's COVID-19 prevention and control and management. And Professor Jae Wook of Korea University will deliver the presentation. Let's meet him.
Hello, everyone. I'd like to thank all of you for attending Bio Incheon Global Conference. Welcome, everyone. I'm Professor Jae Wook Choi from Korea University College of Medicine. I'd like to take this opportunity to express my sincere gratitude to Incheon Metropolitan City, KOTRA, and Incheon National University for hosting today's event, and also to Asian Federation of Biotechnology, which is hosting today's event. Today, I'd like to talk to you about the current situation of the infection prevention and control for COVID-19 in Korea. I'll share the presentation material using PowerPoint presentation. As of August 19, that was the time that I have written this PPT. And about a week ago, I actually finished my PPT and I wanted to shoot the video. However, from August 13th to 14th, there were another wave of pandemic sweeping the country. And reflecting that second wave phenomena, I had no choice but to remake my presentation material and re-record. And also, as of August 25th, my presentation and pre-recording lecture will be given, and I believe that there will be another change. So please keep that in mind. Let's first look at the global situation of COVID-19. As of August 19th, there are 21.9 million outbreaks worldwide and 770,000 deaths, with 181,000 new outbreaks in the last 24 hours. The global COVID-19 pandemic is still going on, and the size, the scale, the gravity of the situation continues, and the number of the deaths continue to grow. The situation in Korea is no exception. Even before August 13, there were less than 50 new confirmed cases a day, but since August 13th and 14th, the number of the confirmed cases increased sharply. The average number of the patients with onset of the COVID-19 in the last 6 days also exceeded more than 200. Some expressed concern that the second wave of the pandemic is spreading, and including Korean nationals, the Korean government is taking active measures. Let's look at some of the major issues in the major quarantine policy related with the COVID-19. As the WHO said, the current COVID-19 situation has come to the point where we cannot expect it to be ended soon. Rather, it is spreading throughout the whole world, and as I mentioned, COVID-19 is on the rise in terms of the mortality as well as also the infectious rate. It is a situation where we need to prepare for long-term war, and in order to prepare for the long-term war, it is necessary to develop a long-term sustainable policies for social distancing. Let me touch upon the vaccine-related issues. Dozens of vaccine-related new products are under research, development, and also clinical trials, and about 7 products are actually showing visible result. UK, US, China, Germany, Russia are already entered into the first phase, second phase, third phase of the clinical trials. I'll explain the meaning of the phase 1, 2, 3 clinical trials later on. You may have seen a lot from the media, including newspapers, but there are two issues related with the COVID-19 vaccine development. In order to make vaccine development universally, validations and safety tests must be carried out before actually producing it in mass scale, which means that validations will be conducted during phase 1 clinical trial and phase 2 clinical trials. In fact, a large number of vaccines have been reviewed for efficacy, and many of them are already in phase 2 and phase 3 clinical trials. But more importantly, much more important than clinical trial itself is the effectiveness and safety. As you know, unlike the therapeutic drugs, vaccines are suitable for prevention purpose by healthy people, and 50% or more, as many as 60% or more of the world populations of billions of people can have COVID-19, which means that considering the situation that a large number of the billions of the healthy people need to be immunized, then we need to verify the safety of the vaccines, which must be strictly carried out. To verify the safety and efficacy of the clinical trials, so the situation must be reviewed up to 0.0 or 0.01%, 0.001% of the likelihood. And also, we need to come up with the alternative options, and also, if anything happens, we need to control the situation. Therefore, a large-scale phase 3 clinical trials of not tens of thousands but hundreds of thousands needs to be conducted, and not only the acute side effect or adverse effect, but also a long-term chronic adverse effect must be reviewed. And even if it takes a year or 2 years or 3 years, we need to verify the safety. Once again, in order to resolve these issues, we need a long-term period, and generally speaking, usually clinical trials requires 2 to 3 years. However, because of the global COVID-19 pandemic spreading throughout the world, we need to conduct clinical trials as a fast track. Therefore, even the most promising thing is that at least early next year or later half of the next year, we can enjoy vaccines that are universally proven to be safe and effective. Of course, some Russian vaccines have announced that they have already studied phase 3, and they announced that they are giving these immunizations to the people, but without having verifications of the safety. We would like to express our concerns over their hasty actions. China, UK, and many countries are developing COVID-19 vaccines, as you have read from the newspapers. And even if COVID-19 vaccine is developed, there are a couple of things that we must consider as an outstanding issues. As you know, the neutralizing of the antibody formations is only a part of 50 to 40% or as much as 60% of the vaccinations. And it is predicted that only neutralizing antibodies can be performed. And it is not 100%, but once again, let me emphasize, not 100%. A formed central antibody does not last for a lifetime. It is predicted that central antibody will last for a short period of time, as little as 1 month to the 3 to 6 months. That is predictions. In fact, issues of this central antibody formation and sustainability in these neutralizing antibody vaccines are similar to the seasonal flu vaccines. The seasonal flu vaccines would also need to be taken annually. So immunizations must be done on an annual basis, and the durations of the antibody does not last long. And also antibody, when it's formed, it's usually 40 to 50%. Nevertheless, the government, the medical community recommends the public to get the seasonal flu vaccine every year because it's effective, merely 40 to 50%. Even if the antibodies are not formed, if you are vaccinated, then the symptoms will be very mild. In addition, even if the virus mutant influenza virus changes every year rather than not receiving the vaccine, it is recommended that vaccine is redeveloped according to a new vaccine corresponding to the virus mutation. So public health point of view, there are a great effects and benefit. Therefore, in a similar form, it is important that antibody production rate is low, and even if sustainability is a little bit lower, still the vaccinations will be very good countermeasures against COVID-19 can even alleviate and end pandemic. Of course, one step further down the road, if antibodies from the people with essential antibodies formed on the basis of getting vaccines after the infection with the COVID-19 identified so-called immunity certificate format or COVID-19 immunity passport can be provided so that we can alleviate travel restrictions or transportations or the entry restrictions for the overseas travel. This is realistically quite important. So utilizations of antibody passport is things that we need to consider. However, the exact amount of the durations of the antibody formation or the also the effectiveness of the antibody is not well proven yet. Therefore, after confirming the effectiveness of the vaccines, we can discuss about the immunity certificate. In fact, many countries are actively reviewing immunity certificate to ease travel restrictions, but WHO and many experts say that the overall review is that it's still premature. Of course, it is better to leave the door open, and probably when the effectiveness and safety is proven, immunity certificate can also be used. One of the regrets is that the COVID-19 virus has been overlooked, the possibility of air infection or air transmission. WHO did not take it seriously. Last month, from 32 countries, 239 scientists around the world have gathered together to point out about the possibility, once again, that the virus could be spread in the air and pointed out that it is necessary to change the guidelines for precautions and ventilation measures, management measures with the possibility of the air transmissions. In fact, WHO has denied the possibility of airborne transmission across COVID-19 virus, including MERS, and it is unlikely that the possibility of airborne transmission is possible only by contact. However, it is already known from the result of the many students that COVID-19 virus infected people, and through their droplets and coughings and breathings over a distance of 1 to 2 meters, the possibility of infection through droplets in the same space, confined space, and droplets through droplets, various research result reports that the coronavirus can be accumulated. And based on this, also, the research results are not only based on the COVID-19 virus, but it was also already known during the MERS time or MERS virus in the past. It is not too late to think about the risk of the air infections and transmission. In addition, I am glad that it was a little bit belated, but WHO decided to acknowledge and decided to strengthen the active preventive and management measures. I hope that the medical scientists and experts from various fields related to the environmental engineering, environmental air pollution engineering, and also the dust proofing and preventions have gathered together to actively address the possibility of air transmission infection. I sincerely hope so. Now, I'd like to emphasize the importance of social distancing. There is simulations of the effect of the social distancing which I'd like to introduce. This data was shown in the States. on a small town with a population of 200, we did a simulation to understand the spread of the virus. So national lockdown and social contributions, all of these were reviewed, and also the simulation was done. What you are looking at right now is that this data shows people. Every dot represents a human being and spread the infected person through the movement and contact of such people indicated in red. And when they are recovered, the red color will turn into pink color. After a certain period of time, you can see that they all turn into pink. You can watch from the simulation, and when the human exchange occur, then the infection can be increased explosively. So for example, the infection can spread widely, and the hospitals, medical professionals cannot tolerate or bear such burden. That means unfortunate sacrifice can also happen. Now let me tell you about the border lockdown. Right now you can see that the lockdown cannot be completely done. No matter what they do, after a certain period of time, the lockdown will, in a way, be eased. And as time goes by, once again, it will be on the rise. However, compared to the previous situation, the infection can progress slowly. At the peak of the infection is not a mega scale, which is quite encouraging. Still, but the effect of the delay of the infections and also the flattening of the peak of the infection in the first 1 month or 2 months, during that time, as much as the time according to the effects of the infection delay occurs, and then sometime we could not invest enough money for building the infrastructures. So after all, social distancing is important, and social distancing is when people are at home without moving around. If you do the social distancing without moving from one home to another one, it will be like this. As you can see here, there are many points, and unlike before, these individuals do not move but remain still. This will reduce the overall amount of the movement in the society as a whole, reduce the frequency of contact, and also reduce the risk of infection, which increase the infection, but the progress very slowly and peaks very low. So, invariably, institutional personnel to maintain society, police, medical personnel, and also all of mail delivery people, all of them plus the quarantine is successfully completed to a level that is not to be worrisome or can be reviewed as social distancing effect. That's in that sense, the quarantine can be completed, so unnecessary human sacrifice can be prevented. That's the effect of the social distancing in Korea. In Korea, social distancing is comprised of the 3 steps: level 1, level 2, level 3. The number of the infected people is less than 50, or if it's a 50 to 100 people, or more than 100 people but less than 200 people, depending on these 3 stages. And we have come up with the indications of the social distancing. You can see that the reference material is for the stage 1. August 15th, Seoul, Gyeonggi, Incheon, in this area, social distancing level 2 has started. The condition for level 2 of the social distancing, that no assembly should be carried out with less than 50 people indoors, no more than 100 people outdoor, 12 multi-use facilities, and hazardous risk facilities that can be spread infections. Stage 3 is even more tougher, preventing more than 10 people from gathering or even indoors, or banning public gathering outdoors. So utilizations of all of these facilities are prohibited. However, in case of the school, they are opening the school through a virtual class. So once again, the purpose of strengthening social distancing is crystal clear. As you can see here, the size of the infection, as you can see on the right figure, we want to flatten the curve, and at the same time, we'd like to enjoy the benefits of the infection control doing the simulation. And also, we want to check the competency of the healthcare workers in Korea. The effect of the social distancing has already provided concrete scientific evidence. So as you can see here, the reproductions or index of the infection is 2.7 to R 1.7. So size of the infection has been decreased or delayed. On the left graph, in the US, social distancing, when they started 2 weeks before or 1 week later on, you can see the total number of the mortality or can be also changed. This graph shows a very famous cases, and this is a factual based information. In 1918, in case of the flu which occurred in the Philadelphia, the area had a very high peak and a lot of death occurred in the case of St. Louis, the second blue color as shown on the right. The size of the infection wasn't as high as it was in Philadelphia, and the infection was delayed so that there weren't as many victims in Philadelphia. The reason is now related to social distancing. Philadelphia did the social distancing only 2 weeks after the first patient outbreak. In case of the St. Louis, social distancing was implemented just 2 days after the first case. In other words, it will be very interesting to see the scientific evidence to see how active and strong social distancing at an early stage can make a huge difference in the spread of the infection. Nevertheless, if a social distancing persists for a long time, it is inevitable to elevate the social distancing, and we need to reduce or minimize economic, cultural, and the social shocks. And if so, infections will increase again, increasing again, decreasing, increasing again, and then increasing. So this is a long-term war that we need to be prepared about. And social distancing and transformations of the quarantine policies to prepare for the long-term war is extremely important to prepare for this. In case of Korea, for almost 7 months have gone by, the publics are getting tired, losing their patience, and also the economic and other sectors' influence is detrimental as well. In light of that, we need to release social distancing. We need to transform our philosophy. However, it is very important to understand to what extent the social distancing should be relaxed or should include the quarantine policy as well. Now, let me tell you about the final implication. It is still too early to evaluate and also evaluate the current COVID-19 quarantines, because not only in Korea, but a COVID-19 pandemic is in progress. In conclusion, COVID-19 pandemic is in progress globally, and also it seems that long-term are inevitable, and the long-term war is unavoidable. Only some time ago, in Korea, the achievements and also countermeasures of the K quarantines are widely known. Early detections of massive mass tests and active tracing and early treatment, these 3 T's and policies were very, very effective. in controlling COVID-19. Therefore, the number of the infected people and also the number of the confirmed cases were not that high. Not only that, we had operated drive-through systems and other creative systems that can guarantee the social and also other sectors, and we can stop a break on the proliferations of the infections. But as you know, from August 14, the COVID-19 patients drastically increased, and every day around 200 patients are being confirmed. In the past 6 days, more than 1,200 people were infected. Nationwidely, another pandemic is spreading. So there are concerns being expressed. So once again, let me emphasize the preventions and also management of the COVID-19 and the control of the COVID-19, early detections, and also the outstanding leadership by the K quarantine. And secondly, the social distancing program must be well complied and also be implemented. And third, devoted contributions by the healthcare workers. So these three sectors need to work together. The social distancing program is the most important factor in the leadership and participation in medical field, dedications, and quarantine authorities. So participating appropriately in social distancing, such as limiting the social discharging groups, is very important. And once again, the public social distancing, doing it voluntarily, and social distancing program is the most important thing. Nationwidely, if anyone and everyone voluntarily and aggressively wear mask and also comply with the social distancing, then we can flatten the infection, we can delay the confession. Of course, the damage, the suffering of the public, and also the economic losses are huge. However, the long-term war is unavoidable, and COVID-19 is likely to go into a big, long war. And for that, we need a social distancing program and continuous social distance program. And we believe that this could be our long-term plan as well. Until the early 2021, long-term programs, how we can improve or mitigate economic impact, and how can we enhance the quarantine system. There could be some conflicting of the ideas. Even though the ideas are conflicting, we need to wisely overcome, we need to harmonize these systems when we meet the realistic policies, which is urgently required if we do that. And when we implement that in a masterpiece way, when the COVID-19 ends next year, we can recover our society, economy, and at the minimum, 3 years focusing on developing the master plan is very important, and continued development of the social distancing is important. So this must be done nationwidely, and various ministries, Ministry of Foreign Affairs, Ministry of Industry, Ministry of Equipment, Ministry of the Employment and Labor, every single government ministry must agree in a way that is based on the social consensus, and it seems necessary to prepare the detailed and practically long-term policies. I'd like to emphasize once again that in conclusion, the role of the quarantine is important, and in the March and April, you can see that quarantine role is important, but for the long-term war, we need medical quarantine. On top of that, social consensus and social policy, economic policy must be well harmonized. Let me give you a conclusion. I once again emphasize to respond to the COVID-19 in preparations for the long-term war, but I hope that it will continue through the trust, solidarity, and voluntary participation through the triangular of the medical people and quarantine authority. And I'm sure that these can continue Unfortunately, since last July, the social distancing policy has been somewhat relaxed, both economically and also the revitalization purpose-wise. On July 23rd, representative was allowed to be a church and religious group. And it started to allow the sports spectators as well as the policies and confirmed to elevate this part, such as the encouraging travel or eating weapons. And policies have been continuing. And unfortunately, due to various medical institution issues, cooperation between the medical community and the government has been broken down a little bit. And instead of collaborating, there was some conflict and confrontation going on between the medical community and the government. So once again, let me re-emphasize that the cooperations and trust between the medical community and the public are critical as we are faced with the nationwide COVID-19 pandemic. And I think it is important to restart the building of the solidarity, and we need to come up with the countermeasures. Only when we do that, I'm sure that we can effectively address the infections of the COVID-19. This can be a new starting point. Thank you very much.
Thank you very much, Professor Jae Wook. Thank you very much for your presentation. And another question was raised on the chat. Sensitivity and specificity of Korean medical devices. How is it? So let me give you a brief answer. Our Korean kits, in particular molecular diagnosis kits, it's hard to give you specific numbers, but we have been able to make our kits very efficiently, and also we developed reagents. And as far as I know, those two, sensitivities and specificity, are almost 100% for Korean kits. So as I mentioned before, it's hard to give you specific numbers and accurate numbers, but our Korean kits are second to none. So this is the answer to your question. So with this, we'd like to conclude session 2, which was held under the theme of COVID-19 diagnosis and prevention and control. A lot of information have been covered, and I believe you were able to hear many directions and information as well. And I hope today's conference will be a good opportunity to develop a more effective technology and carry out more effective prevention and control. And once again, thank you very much, Dr. Lee Jae-ho and Vice President Jo Jin-hee and Professor Lee-hak Ko and Professor Tanya and Professor Song and Professor Choi. I'm Professor Kim Min-gon of Gwangju Institute of Science and Technology. Thank you.